I think oftentimes what we see in general medical practice is that there are lots of interesting questions related to the care of our patients or the evidence that we need to take care of our patients that we don't have the answers to. And so it's really to give generalists the research training to be able to conduct rigorous scientific studies to answer these types of questions. Hi, I'm Jennifer Haas. I am the co-director of the fellowship program. I am a professor of medicine at HMS, and I am a primary care physician at Massachusetts General Hospital.
Hello, my name is Dr. Ed Markantonio, and I'm Section Chief for Research in the Division of General Medicine at Beth Israel Deaconess Medical Center and Professor of Medicine at Harvard Medical School. I'm also the Program Co-Director for the Harvard Medical School Fellowship in General Medicine and Primary Care.
Hello, my name is Felipe Marcondes. I am a first-year MGH Fellow.
Hi, I'm Landon Hall. I completed the fellowship in 2019 and I was at the Boston VA hospital.
This program has one of the longest track records of any general medicine training program in the country. We've been going for over 30 years at this point and have trained many national leaders in general medicine.
It's based at 5 sites: Brigham and Women's Hospital, Mass General Hospital, Beth Israel Deaconess Medical Center, which is where I'm based, Cambridge Health Alliance, and the Department of Population Medicine.
There are so many hospitals and resources here, and the university systems also seem to supply an endless wealth of resources and interested young people and cross-collaboration.
We also have a very strong partnership with Harvard School of Public Health, and almost all of our fellows obtain a Master's of Public Health or Master of Science degree as part of their fellowship training.
I have loved the classes at the School of Public Health. I of course have heard about it a lot before coming into the program, about the quality of the program and of the classes. And I think the summer courses, especially the PCE program, the program in clinical effectiveness, has been really foundational for me as I started the fellowship.
I looked at a number of Gen Med fellowship programs or programs similar to that, and this really stood out to me as the program where right off the bat there wasn't a delay in terms of getting started with the program and clinical effectiveness. Some didn't really start coursework until a few months in, and looking back and how quickly kind of your fellowship time goes, I thought that was key to kind of have under my belt early on.
So first you will be paired with a mentor or possibly with a mentorship team that are aligned with your interests and have methodological expertise in the area that you want to study. You will then design 2 to 3 research projects focused in that area, ideally using a variety of different methods, possibly analysis of a secondary data source, but also maybe collecting limited primary data study that's feasible within the context of a 2-year fellowship.
And the dedicated research time has been the majority of my time. It's finding the time to think about the projects that I want to be involved in, developing the research question, and then doing a literature review on the topic that I'm interested in. And then from that point is really acquiring the data that I want to work with and then starting the analysis.
So every week there's either a didactic presentation or a fellowship conference where the fellows will present their research in progress, and they all get together and talk and some mentors at the sites will also attend those presentations and be available to provide feedback to the fellows and also answer their questions. One of the real key elements of the program is a focus on mentorship. And we pride ourselves on having a very fellow-centric program. So if you join our program, you won't just join a senior faculty member in his or her research program. Rather, you will be asked, what is your passion? What are you most interested in studying? And we will focus our efforts to enable you to study that field.
In fellowship, my mentors, there were a few who, some were kind of, I had a mentor that I kind of started out with, who I worked with all along, and then I developed other relationships along the way. But what was really clear to me, and where I feel really lucky, is that I never felt anything but supported in my goals.
The environment that I found here in the fellowship and with the faculty and with my cohort of fellows has been tremendous. So I think that has been something that I've been really happy with here in the fellowship is the accessibility of the faculty and just the great group of fellows that I've been having the privilege of working with.
In terms of takeaways from the program, I think this was best summarized by our graduating fellow at Beth Israel Deaconess this year. She said that at the end of her 2 years, she felt like she could take any clinical problem and dissect it, identify an answerable research question, find the appropriate data or the appropriate design to collect the data to answer that question, do the analysis and write it up. So really have the soup to nuts toolbox to be able to take an interesting clinical problem and do a study and bring it to its conclusion and publish it in the literature.
If anybody is interested in becoming a physician investigator and being at a world-renowned place that has the resources to make that happen, and I think the HMS GIM Fellowship is for you.